Welcome back to Today's Health. In this segment, we're talking about treatment options for obesity with Dr. Zubin Bhesania. Doctor, now if someone is not yet ready to commit to having a bariatric surgery, there is a non-surgical option that is available called the intragastric balloon. Can you tell us more about this?
Sure. This is a device that obtained FDA approval approximately 2 years ago. And what it is a silicone-filled saline balloon that is placed in the stomach. And what it does is takes volume up in the stomach, so when you eat, you feel full sooner. It's non-surgical because it's placed endoscopically, so there's no cutting of anything. It's placed with a telescope down into your stomach.
Can you tell us more about what happens during the procedure?
Sure. Basically, we have a gastroscope, and that's this little black tube here, and it's a telescope that we place into the stomach. We then have a balloon, essentially, that's placed in the stomach and filled with saline. As you can see, the balloon takes up a large amount of space within the stomach, and what this does is creates a feeling of fullness. So when people eat, they feel full, and they hopefully eat less because they feel full.
Now, what are the benefits versus risks for this procedure?
Well, this procedure is a temporary procedure. So the balloon is designed to stay in the stomach for approximately 6 months. So it does need to be removed after 6 months, and that's to prevent any complications from the balloon. The weight loss we see with the balloon is different than the weight loss from surgical procedures. It's actually designed for people that are not as heavy as the ones we consider for surgery. So this is designed for the person that needs to have 20 to 40 pounds removed, and this is a perfect procedure for that.
Since this is a temporary procedure, is it possible to have the balloon for 6 months, have it removed, and then have it put back in, a new one?
Sure, that is possible. The problem is cost, because it is a self-pay procedure, but you can have a series of balloons placed.
Now, if someone is interested in learning more about this procedure, how would they do that?
They basically have to contact the Bariatric Center here, and we would arrange consultation for those patients.
Doctor, this has been great information. Thank you for joining us today.
Thank you.
Stay with us. We'll be back after this break.